very interesting set of events going on here in the sports world. Michael Sam, of course, is a self-proclaimed gay individual, and he was on the championship Missouri football team, a defensive end, All-American. He's All-American, and a really great guy. And he came out and said, "Hey, man, I'm gay." And so we have to examine this because he occupied 3 pages of the USA Today. And so let's have a look at this. Is gayness genetic? No. Is gayness a choice? No. No. I said, no, gayness isn't a choice. This is a congenital event. This is a congenital event. Just like somebody who is born with Down syndrome, somebody who is born with cerebral palsy, somebody who's born with a heart defect, somebody who is born with cleft palate. This is a congenital event. And it happens in the first 3rd to 7th week of pregnancy. Very well documented. The piece of the brain that's involved is the preoptic hypothalamus. The preoptic hypothalamus, which is the piece of the brain that's involved with sexual drive, sexual hunger, sexual choices, and it really has nothing to do with your DNA sex, your DNA gender. All kinds of things happen. For instance, there's intersex kids, which is the sort of medical name for hermaphrodites, where kids are born with both male and female equipment. And doctors will immediately do a blood test when the baby's born, a hermaphrodite, and they will look for Barr bodies. It's named after Dr. Leonard Barr, B-A-R-R, who found that the second X chromosome in female shows up as these little bodies inside the nucleus of white blood cells. And very dramatic, very easy to see. And so in 3 seconds, you see very quickly if somebody is genetically a female. And they say, well, they're genetically a female, and so we can just cut off the male parts here, and everything will be fine. Well, 85% of the time they're wrong, because the same thing, the same deficiency during the 3rd and 7th week of pregnancy actually caused the number of cells in the preoptic hypothalamus to be less than in a heterosexual male or female. And so they can be genetically a female, but they can be, from the sex drive standpoint, a male. And so they've made a lot of mistakes here, about 85% of the time, caused a lot of problems. Well, in Europe and Scandinavia, the EU, Finland, Switzerland, all these countries, they're waiting till these kids who are born intersexes, the ones who are born with both male and female equipment, the hermaphrodites, they're waiting till they're 10 years old, because then the kid knows in their head which one they are. It doesn't matter what your genetic sex is. Think about it. There's a whole spectrum of individuals that mama was missing something between the 3rd and 9th week of pregnancy, and they wind up, they're asexual. I know a lot of asexual people who are just, they have no interest in sex with boys or girls, regardless of their gender. And everybody has a crazy Aunt Ruthie or a crazy Uncle Fred who, they never got married. They went out for a few times when they were a teenager, but they just never found anybody. Well, they are asexual. They have very few of those cells that's necessary to determine sexuality in the preoptic hypothalamus. And then there's bisexual. There's them that say, well, I can come see, come saw. I can, get on with a girl, or I can get on with a boy. Either one makes me happy. Those are bisexual. That's kind of the next step up. And then there's those who are males who would rather be with males, and then there's females, the lesbians, who would rather be with females. And then you get into the heterosexuals when they have all the cells in the preoptic hypothalamus that is standard for heterosexuality. So being all these various sexual divisions, I think there's like 600 of them. There's so many possibilities here. There's over 600 differences that can happen when mom is missing, but some nutrition, zinc, folic acid, manganese, during the first 3 to 7 weeks of pregnancy. And so this just shows, when you look at all these congenital birth defects, all these congenital events, we've seen this in animals. We've eliminated all of them in animals. When you have the same situation going on in cattle and sheep and goats, it's called free Martinism. Okay, it's called free Martinism, where the females think they're males and the males think they're females. And so this happens in animals too. And this is not a choice. This is absolutely not a choice. This is a congenital event, just like babies are born deaf. It's a congenital event. All right, totally preventable, not reversible after the baby's born. So these people can be very talented. I just am interested to follow, see what's going on here. Obviously, Michael Sam has been able to get on with his teammates at the University of Missouri, and they knew he was gay, for the entire time he was in there. And these kids usually know it between the ages of 3 and 10. They know it when they're 3 and 10. You have a little grandson, has all the equipment that's a boy, and you say, okay, grandson, let's go out, I'm going to take you out and you play ball with the boys. Well, no, I'm a girl. Or you go the other way around, you say, come on, honey, all the girls are playing with their dolls. Well, all those girls will get you. Well, no, I'm a boy. You've all heard of tomboys. Oh, well, here we go, tomboys. Well, there are varying degrees of tomboys. Some are really females. They're female all the way. They just like dad, and they're daddy's little girl. And they like to do what dad does because they want to be with dad. But then there's some tomboys that are actually have all the equipment as a female, but in their preoptic hypothalamus, they're a male. So think about this, and we'll kind of keep our eye on Michael Sam, but I think he'll do okay. Just remember, it's a congenital event, totally preventable, but not reversible. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about a-fib, or atrial fibrillation, as they've got a Fox News story here that's headlined, "Take it from Howie Mandel. Atrial fibrillation is a dangerous deal." And apparently Howie Mandel, the former comedian and now game show host, has been diagnosed with a-fib. Said he went to his doctor because he was feeling not really feeling real well. He said he thought it was a consequence of his busy lifestyle. He says, I do about 300 live tapes per year. I was on a plane every day in a different time zone, sleeping at different times. I felt lightheaded, dizzy, and tired. And, I thought of you, Doc. I said, you travel about that much. You don't get dizzy and lightheaded.
Sounds like my schedule.
Yeah. So he went to his doctor. Doctor put a stethoscope to his chest and said, uh-oh, you've got a-fib. And so they say that a-fib is the most common type of arrhythmia or irregular heartbeat, affects about 6 million Americans, can raise your risk of stroke by up to 5 times. And they go on to say that Mandel said he was physically fit, funny, fast talker, fits the profile of a person who may be affected by a-fib. They say a-fib mainly affects people 60 and older. So the heart chambers called the atria and the ventricles don't coordinate properly, move so fast they don't fully contract, causing a quiver. Said people with a-fib, their hearts can race as fast as 350 beats per minute, 4 times faster than the average of 80 beats per minute. Mandel, when he got his diagnosis, was beating at about 170 times per minute. And so now, since he's a high-profile person, he's been hired by Pfizer, Bristol-Myers Squib, manufacturers of medications for a-fib, and he's now been hired to become the spokesperson for a campaign that they're doing called Fibs or Facts. In fact, they have a website where you can go and take a quiz to familiarize yourself with a-fib and find out whether you might have it or not. And for every quiz that's filled out, Bristol-Myers is going to donate $1 to the National Stroke Association, up to $25,000. Like with the billions and billions they make, they're only going to kick down $25,000. Mm-hmm. But they go on to say that there's procedures and medications. They can do a cardioversion, a controlled electrical stimulation to shock the heart into a regular rhythm, or have a pacemaker implanted. And they also go on to say you can exercise regular, eat healthy, stop drinking alcohol and smoking as lifestyle changes that can help with a-fib. Not one mention of any kind of nutritional supplementation or the fact that a-fib is often caused by a back problem.
Well, you hit the nail on the head, Doug. A-fib is 99.9% of the time has nothing to do with the heart. It's always a back problem. In fact, I had a couple of my lecture last night in Jackson, Mississippi, that had a-fib. And, of course, the doctor wanted to install pacemakers and defibrillators. And then if that doesn't work, which it won't because it's a back problem, then they want to do an ablation where they actually stick an electric wire up into their heart and kill portions of their heart muscle, hoping to kill the part of the heart that's running amok. But that doesn't work because it's a back problem. And then they do the retroversion, which you mentioned. And retroversion is they electrocute the patient under controlled circumstances and try to wake them back up, hope to reboot the heart rate. And really what happens is they get degenerative disc disease. That's why it's a disease that mostly occurs in people over age 60, because as they shrink, now I always ask them when they have a-fib, have you shrunk? Oh, yeah, I've shrunk 2 or 3 inches. Okay, well, there you go. as the discs shrink in between the vertebrae, they get degenerative disc disease. They get thinner and thinner. The vertebrae get closer together, and particularly between T1, 2, 3, and 4, thoracic vertebrae 1, 2, 3, and 4, when those discs shrink, the vertebrae get closer together and smash the roots of the spinal nerves to control the rate and rhythm of the heart. So my goal, when somebody has a-fib, we give them all the nutrition, the healthy heart and brain pack. We give them everything necessary for the heart, nutritionally, but we also throw in extra glucogel to support and promote maintenance repair of that disc, push the vertebrae apart, and a-fib goes away. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go for callers.
Let's head to Australia. And Mary, you're on with Dr. Wallach.
Good
hi,
day, mate.
Dr. Hello, how are you?
Okay, cheers. How can we help you?
Well, I've got two big problems, really. I've had migraines daily for the last 16 years. I take Imitrex every day, which has really just destroyed my gut and made me food sensitive to everything. And a few years ago, I had some blood vessels cut around my head in South Africa in an attempt to fix it, and the doctor went a little too far, and now I have these vibrations on the right side of my head that are always there. And I have a really bad knee, arthritis starting in my knee, and about 5 days ago it's just seized up, and I don't walk very well at all, and I'm not quite sure what's going on there.
Okay, well, how much do you weigh? How big a girl are you? What do you weigh?
I'm 5'11", and I weigh 140 pounds.
Okay, so you're slim.
Yeah, I am.
Mm-hmm.
Yeah, I'm also a vegetarian, but I do eat some fish. I do have low B vitamins.
Okay.
And I've got cataract starting in my eyes and a little bit of retina degeneration in one eye. Let
me ask you some questions, because okay. Let me ask you some questions. Do you have any history of skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No, but I do sort of get these little white spots on my skin every once in a while. I think it's immune system.
Mm-hmm. Where do these white spots occur? On the trunk of your body, your legs, your face, or where?
Just on my tummy. I put Selsun Blue shampoo on it, and then they go away.
Mm-hmm. Okay. Did you ever have asthma as a kid? You sound a little nasal to me.
No, I never had asthma.
Do you have any brothers and sisters?
Yes, they have migraine problems as well.
Do any of them have asthma?
No.
Any of them have skin problems?
No.
Any of them have their appendix out?
I don't think so.
Well, you'd know, because they complained about it, okay?
No,
lastly, do any of you, your brothers and sisters, yourself, have any history of constipation or diarrhea that really plagued you?
No, but I have that, just sort of either one or the other, constipation or diarrhea, most of the time. Mm-hmm. I try to eat gluten-free breads, but the gluten-free breads give me diarrhea.
That's interesting. Okay. All right. So, okay, Shar, I think you can handle this. What do you think, Shar?
Well, she definitely has a gluten intolerance, definitely.
Yeah, I think so.
Yeah.
I agree. And so at 140 pounds, with a knee problem, arthritis, hang on, get your paper out, and we'll get back to you with with your program after these messages. Doug, let's go right back to Australia and Mary. And, okay, 140 pounds, knee problems, arthritis, that sort of stuff. I would go ahead, and especially with being a vegetarian, I would go ahead and build a program, because we have to do the vegetarian stuff. I'd get 2 quarts a month of the Cal Toddy. There's no shellfish or anything like that. There's no animal products in there. Cal Toddy. I want you to take an ounce of Cal Toddy at breakfast, ounce Cal Toddy at dinner time. That'd be 2 quarts a month. I want you to take the Beyond Tangerine 2.0. I want you 2.0 specifically, totally gluten-free. And I want you to take 2 scoops of that at breakfast and 2 scoops at dinner. Also, I want you to take what we call multi-EFAs, multi-omegas, I guess here, multi-omegas. I want you to take 3 of those twice a day. That'll be 2 bottles a month of the multi-omegas. They come from Evening Primrose Oil. And that'll give you your basic program. Now, what I do want you to do also for the migraines, as well as giving you some something that's going to help support maintenance and repair of cartilage and ligaments and tendons in your joints, I want you to take what we call the Fucoid Z. It's a capsule. I want you to take 5 of those twice a day, and that'll take 2 bottles a month to pull that off. 3 bottles, actually, 3 bottles of Fucoid Z, 5 capsules twice a day. It actually comes from a red marine algae, but it actually supports and promotes maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And lastly, for the migraines, I want you to have what we call Ultimate Daily Tablets. Ultimate Daily Tablets. I want you to have 3 of those twice a day. There's 1 bottle a month that actually dilates blood vessels, supports, promotes healthy blood flow through obstructed arteries. Okay, now you need to give up bad stuff. Even vegetarians eat bad stuff. No fried foods. No fried foods whatsoever. I don't care if stir-fry organic foods, you're stir-frying with extra virgin, olive oil, coconut oil. No oils. No frying. Okay, as far as processed meats, you probably won't eat processed meats with nitrates and nitrites, but I've just mentioned that for everybody else. And then, of course, no gluten, no wheat, barley, rye, and oats. As Shar said, you're probably very gluten intolerant. But I wouldn't worry too much about eating bread. I would prefer you have baked sweet potatoes with butter and cinnamon as a source of calories with breakfast. You do not want to be eating oatmeal. There is no such thing as gluten-free oatmeal. That's all the big hype to sell oatmeal, but it's not true. And so for breakfast, it means no cereals, unless you're eating a drop-dead gluten-free cereal, but I just wouldn't get into the habit of that. I like baked sweet potatoes with butter and margarine. And if you could see yourself, if you're going to eat anything, you say eat a little bit of fish, but I would like to see you eat eggs instead of fish. You get much more nutrition from eggs. Your body weight would have you eat 4 to 6 eggs a day. They could be soft scrambled in butter. They could be soft boiled with soft yolks. They could be soft poached with soft yolks. And for the cataracts and retinal degeneration, I would go ahead and take 3 selenium twice a day. There's 2 of our bottles of Ultimate Selenium. Take 3 of those twice a day, and you'll find that you're going to get this really serious antioxidant effect of the selenium. And you've got a complex of things with the migraine headaches. You got the arthritis. You got the retinal degeneration. You got cataracts, and so forth. And part of any tummy problems, okay, alternating constipation and diarrhea, this all goes along with the gluten intolerance. And so being a vegetarian is problematic because you're eating a lot of grains, you're eating a lot of wheat, barley, rye, and oats, and you just got to give those things up, and that'll go a long way towards allowing your body to absorb more nutrients and heal yourself. It's also imperative that you stay away from oils and fried foods. Well, we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages.
Let's head to Arizona, and Daisy, you're on with Dr. Wallach.
Hello, Daisy. You're on the air.
Yes. Hi, Dr. Wallach. Thank you so much for taking my call today. I'm very grateful. I'm calling on behalf of a friend who... Yes?
How can I help you?
Yes. Hi, Dr. Wallach. Thank you for taking my call today. And I'm calling on behalf of a friend who is 47 and a half years old, 120 pounds. She's in her first trimester of pregnancy, maybe 6 weeks, give or take. And she, because of her age, is concerned about having a healthy baby, pregnancy, and delivery. She's been on the products, the longevity products, for over a year. She's primarily gluten-free, and she's been taking almost just a huge wide array of the products, an innumerable amount. So she's not sure if there's any that she should not be taking, and she's also wondering if there are some additional ones she should be taking as far as B12 and folate. She also was taking some products that were not longevity, nascent iodine, a little bit of L-arginine, some Adderall, krill oil, astaxanthin, D3, CoQ10, serapeptase, and K. And she's not sure if she should be continuing to take those.
Okay. Did she have children when she was younger?
What?
Did she have children when she was younger?
The first child was born at 34.
Okay, and how many children does she have?
She has 4 children. She miscarried one between the last 2.
Okay. All right. Well, the fact that she's been taking the longevity products for a year, and I'm assuming that's like 10 or 11 months before she got pregnant, that's a good thing. Now, the only caveat is you can take a lot of products and still not get all the nutrients. I'm assuming she took one of our multiples, either something like Beyond Tangerine or Ultimate Classic or Tropical Plus or something of that nature to get, the multiple, which gives you vitamin A and C and D and E and K and all the B vitamins and calcium and magnesium and manganese and copper and selenium and zinc and so on. Very, very important to get all that stuff. As you know, there's 60 essential minerals, there's 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and you can take a lot of products and not get all that, and so it's imperative that she make sure she's getting all of it. So can you tell me, just very briefly, I don't want you to read off 200 products, but if she has, what multiple do you know she's taking?
The Healthy Start Pack.
Okay, very good. Well, the Healthy Start Pack, as the name implies, that will give her perfect biochemical nutrition for 100 pounds of body weight for a month for human flesh. 120 pounds is close enough to 100 pounds. She's getting far, far greater nutrition than somebody who's not getting the Healthy Start Pack, so that's good. If she needs more of the B12, we do have the D-Stress capsules. It's got B12 in it, capital D like David, dash stress. And then to magnify the possibility of absorbing all the B12. Shar, B12 requires stomach acid to absorb B12, so the intrinsic factor works. What nutritional or supplement, what digestive aid would you give this gal, Shar, to make sure she's getting enough stomach acid?
Enzymes.
Yep.
And salt.
Yep, the Ultimate Enzymes, exactly right. The Ultimate Enzymes has stomach acid in it, so in addition to the de-stress capsules, to make sure she's really efficiently absorbing that B12 that's in the de-stress capsules, I'd have her take one of the Ultimate Enzymes, say 2 to 5 minutes before each meal with a couple of ounces of water, and that's going to increase the efficiency of absorption of the B12. Okay? And, of course, if she plays sports, if she works out in the gym, she might want to throw in the glucogel to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae. And if she decides she wants to breastfeed that baby, at about the 7-month mark, I would have her get an extra bottle of OsteoFX Plus so she can take 2 ounces a day of the OsteoFX Plus beginning at the 7-month, and that's going to make sure that she not only has enough minerals for her own bones, but also enough minerals coming through the milk for optimal growth of that baby. And so, give us a call. But, she's got a pretty good handle on things if she's been taking the Healthy Start Pack for a year. Good choices there, Daisy. Okay, Doug, let's go to callers.
Let's head to Milwaukee, Wisconsin. And Toya, you're on with Dr. Wallach.
Well, Toya, you're on the air.
Hello. Thank you for taking my call.
You bet. How can we help you?
My daughter is 3 years old, and she was diagnosed with autism, and I wasn't sure about which products to give her.
Sure. Now, do you think she was born normal and acquired autism later on, or do you think she was different when she was born?
Well, I'm not sure if it happened after they gave her a shot, but I know she was pretty mean as a newborn. She hasn't smiled for a while. So.
Okay. Now, did you breastfeed her?
I tried to, but I didn't have enough milk, so I had to stop around 3 months.
Okay, but for 3 months she got a little bit of milk.
Yes.
Okay, now, question, does either she or you have any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
It seems like for the past 2 years, my skin has been really dry. I'm not sure if it's from the dish detergent.
Well, is it just your hands or is it your back and neck?
It's just my hands.
Okay. And do you have any history of asthma, or does she have any history of asthma or bronchitis as a kid?
No.
Okay. What about belly pain? Does she ever cry and her belly is distended like she got gas in there? Or any sense that she's got belly pain, she's screaming a lot and not really happy?
She was severely constipated. It's hard for her to have a full bowel movement.
Now, has that been since she was born, or is that just recent?
That's been since she was born.
Okay, and you have another child?
Yes, I do.
And 1 or 2 or 3 or 5 or?
She's 5.
No. Okay, so you have one other child.
Yes.
Yeah. Does she have any health problems?
No. Just speech delay, but I don't know if that's a health issue.
I'm sorry, she has what?
A speech delay?
The speech delay. Okay. It could be. Does she have any skin problems or asthma, bronchitis, or constipation too?
No.
Mm-hmm. Okay. Well, yeah. Shar, what do you think?
Well, constipation could possibly be a gluten problem. It's not 100%, but just to be on the safe side, today, with the food the way it is, I would get her on a gluten-free diet.
Absolutely. The whole family, including the dog and the cat and the fish and the bird, needs to be gluten-free. And autism and speech delay are kind of related. They don't have anything to do with vaccinations. That's all a myth. Just absolutely not true. The guy that actually came up with that in a medical journal print admitted that he was trying to push an agenda, and so he came up with that, but it was never did experimental evidence or anything. It was all a big myth and a lie and so on. At any rate, yeah, autism and speech delay, ADD, ADHD, none of that stuff has anything to do with vaccination. Now, the fact that you have one child with speech delay and one child with diagnosed autism and probably got gluten intolerance because they're constipated, I would definitely get yourself and everybody else on a gluten-free diet. You need to take, what do you weigh, Toya?
I'm 140.
Okay, now hang on, get your pen and paper ready. We'll give you a program after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. And let's see, let's go right back to Wisconsin and Toya. Okay, so 140 pounds. I'd like you to have one Healthy Start pack yourself. Divide it in half for breakfast, half at dinner. If you don't have any arthritis or diabetes or high blood pressure, then that should do you. If you have any of those things, then we need to add some secret sauces there. For the kids, this goes by body weight. One Healthy Start pack would last a 50-pound kid for 2 months, a 30-pound kid for 3 months, but both of them need to be on the 90 essential nutrients, and probably it's really easy to give them what we call Tropical Plus. I'd give them, just give them the Tropical Plus, which is a teaspoon of the Tropical Plus per 20 pounds of body weight twice a day, and that's for the 3-year-old and the 5-year-old. And then also I would give them the EFAs. I'd give them the Smart FX. They're small. They can swallow them. Even the 3-year-old can swallow the Smart FX or chew them up. I'd give the 3-year-old 2 twice a day. The 5-year-old I would give 3 twice a day. And then call us every couple of weeks and let us know how they're going. Okay, Doug, we got time for one more?
Yeah, let's head to Georgia. And Laura, you're on with Dr. Wallach.
Hello, Laura, you're on the air.
Yes, Dr. Wallach, good afternoon.
Yes.
I just want to thank you for the job you are doing. And I have a question for my brother-in-law.
Okay.
When I went to Nigeria, he's in a lot of pain. And I asked him why. In 2008, he has a prostate cancer. And this was treated in London by radiotherapy. And after that, he was feeling better. But right now, the prognosis is saying that he has prostate hypertrophy. That means there's enlargement.
It's enlarged. Yeah, prostate hypertrophy is enlargement. But is it do they know if the cancer came back, or is it just men over the age of 50 get prostate enlargement? This can happen whether you have cancer or not. Did they say?
So now they said the PSA is 1.2 test. But right now, why I'm connecting this to the pain is having mid-back pain, groin, hips, knees, both calf angles, and upper arms.
Okay, what does he weigh? What does your brother-in-law weigh?
127 pounds.
137?
27.
127. Okay. Yeah, what I would do is give him one Healthy Bone and Joint pack per month. I'd get him an extra bottle of the OsteoFX Plus, so he can take 2 ounces a day. I would also get him 2 bottles of the ProstFX, a great herbal combination. It includes actually some African herbs in there, as well as North American herbs. And I would have him take 3 of those 3 times a day. And that's going to support and promote healthy prostate size and function. And because he has a history of cancer, I would get him 2 bottles a month of the Ultimate Selenium and have him take 3 of those twice a day. Okay, it's important that he stays away from bad stuff that drives cancer, no fried foods, no processed meats with nitrates, nitrites, no oils, margarines, mayonnaise, salad dressing, cooking oils, and absolutely no gluten, no wheat, barley, and oats. He can eat rice, he can eat sweet potatoes, he could eat yams, he could eat millet, flax, buckwheat, which is not wheat, but no wheat, barley, rye, or oats. And give us a call every couple of weeks. Let us know how he's doing. Okay, we have, about a minute here, Doug?
More like 30 seconds.
30 seconds. Char, you got something to say for 30 seconds?
Yeah, take care of yourself. Again, take care of yourself better than you take care of your car. Do preventive maintenance, and you won't get in trouble in the first place. Stay away from a doctor. They will kill you given half a chance. They are the number one killer of Americans, bar none.
That is true. Everybody knows, even the Center for Disease Control, the number one cause of death in America is doctors. That's charted. Everybody knows it. The number one cause of death of Americans is doctors. Okay, that's because they have a protective monopoly. They're self-policing. They've killed off all their competition. They didn't get the name of being the best doctors in the world because they're the best doctors in the world. They bought it by paying off elected officials. Well, we'll be back another day with Dead Doctors Don't Lie. Thank you, Shar. Superlative job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.